Colorectal cancer is one of the most common forms of cancer in individuals over the age of 40 years. During the early asymptomatic stages, almost all neoplasms of the colon and rectum bleed in a small amount on an intermittent basis. This takes the form of hidden blood known as occult blood. Routine screening of stool specimens for occult blood using a Guaiac slide test is frequently performed in the medical office to screen for colorectal cancer. The medical assistant is responsible for instructing the patient on the collection of the specimens at home for a Guaiac slide test. First, obtain a Hemoccult slide testing kit. Check the expiration date on the slides. Do not use outdated slides as they can lead to inaccurate test results. Greet the patient and introduce yourself. Identify the patient and explain the purpose of the test. Explain to the patient that he will be collecting a stool sample on 3 different days. Tell the patient not to collect a stool sample if there is visible blood in his stool or urine. Tell him that the test should not be conducted when hemorrhoids are bleeding or if he has a urinary tract infection. This is because bleeding from other sources can cause a false positive test result. Instruct the patient in the diet and medication modifications for the Hemoccult test. For 3 days before and during the stool collection period, instruct the patient to eat moderate amounts of fresh fruits and vegetables, bran cereals, and other foods that are high in fiber to promote bowel elimination and encourage bleeding from lesions that only bleed occasionally. Also tell the patient during this time period to avoid red or rare meats and vitamin C in excess of 250 milligrams from supplements and citrus fruits and juices. For 7 days before and during the stool collection period, instruct the patient to avoid non-steroid anti-inflammatory drugs such as ibuprofen, naproxen, and aspirin. Acetaminophen or Tylenol can be taken as needed. Encourage the patient to adhere to the diet and medication modifications because improper patient preparation can lead to inaccurate test results. Provide the patient with the Hemoccult slide test kit. The kit consists of 3 identical cardboard slides attached to one another. These are to collect 3 stool specimens on 3 different days. Instruct the patient not to tear the slides apart. Each slide contains 2 squares labeled A and B. They contain filter paper impregnated with Guaiac, a chemical necessary for detection of blood in the stool. The kit also has 3 wooden applicator sticks and written instructions. Instruct the patient to use a ballpoint pen to complete the information that is required on the front flap of each card. This includes the patient's name, address, phone number, and age, as well as the date of the specimen collection. Instruct the patient that the slides must be stored at room temperature and protected from heat, light, and volatile chemicals such as ammonia, bleach, and other household cleaners. Reinforce to the patient to wait the appropriate number of days after beginning the diet and medication modifications to collect the first stool specimen. Instruct the patient how to collect the stool specimen. First, fill in the collection date on the front flap of the first cardboard slide. If you are using a toilet bowl cleaner, remove it from the toilet tank and flush the toilet twice before proceeding. Use a clean, dry container to collect the stool sample. The sample must be collected in the container before it comes in contact with toilet bowl water. Allow the stool to fall into the collection container. Open the front flap of the first cardboard slide located on the left side of the series of 3. Use one of the wooden applicators to obtain a specimen from one part of the stool sample. Spread a very thin smear of the specimen in the square labeled A. Using the same wooden applicator, obtain another specimen from a different area of the stool. This helps detect blood that is not uniformly distributed throughout the stool. Spread a thin smear of the specimen over the filter paper in the square labeled B. Avoid thick specimens, as this prevents adequate light from penetrating the paper and makes the results difficult to interpret. Close the front flap of the cardboard slide. Discard the wooden applicator in a waste container. Do not flush it down the toilet. Store the slide in any paper envelope until the next day. This allows the sample to air dry overnight in the envelope. Repeat this procedure the next day for the second bowel movement. If you do not have a bowel movement on the next day, then collect the specimen on the following day. Use the cardboard slide located in the middle of the series of 3. Repeat this procedure after the third bowel movement. Use the cardboard slide located to the right of the series of 3. Allow the completed slides to air dry overnight in the paper envelope. Instruct the patient to place the cardboard slides in the mailing pouch lined with foil, seal carefully, and return them as soon as possible to the medical office. Emphasize to the patient that only the foil-lined envelope can be used to mail the slides. A standard envelope cannot be used as it is not approved by the U.S. Postal Service for mailing the slides. Give the patient an opportunity to ask questions. Ensure that the patient understands the instructions for preparation and collection of the stool specimen and for storage of the slides. Improper preparation and poor collection techniques can lead to inaccurate test results. Chart the procedure. Include the date and time, and document that the Hemoccult test and instructions were given to the patient. Once the slides have been returned to the medical office, the medical assistant is responsible for developing them. First, assemble your equipment. You will need disposable gloves, the prepared Hemoccult slides, and the developing solution that accompanies the testing kit. Check the expiration date on the developing solution bottle. Outdated solution should not be used because it can lead to inaccurate test results. The developing solution contains hydrogen peroxide and should be stored away from heat and light and should be tightly capped when not in use. The solution should be stored properly because it is flammable and evaporates easily. Sanitize your hands and apply gloves. Open the back flap of the cardboard slides. Apply 2 drops of the developing solution to the guaiac test paper underlying the back of each smear. Apply the drops directly over the center of each smear. The developing solution is absorbed through the filter paper and into the stool specimen. This solution can irritate the skin and eyes. If contact occurs, immediately rinse the area with water. Read the test results within 60 seconds. The reading time is important because the color reaction may fade after 2 to 4 minutes. Fecal blood loss greater than 5 milliliters per day results in a positive reaction, which is indicated by any trace of blue on or at the edge of the fecal smear. If no detectable color change occurs, the result is considered negative. As you can see, slides 1 and 3 are positive and slide 2 is negative. Perform the quality control procedure on each slide to ensure the accuracy and reliability of the test results. This procedure is performed by placing 1 drop of the developing solution in the space between the positive and negative performance monitor area. The results must be read within 10 seconds after the application of the developer. If the slide and developer are functional, the positive area will turn blue, whereas the negative area will show no color change. Failure of the expected control results to occur indicate an error and the test results are not valid. This may be due to outdated slides or developing solution, an error in technique and subjecting the slides to heat, sunlight, or strong fluorescent light. As you can see, the quality control results on this test reacted as expected. Properly dispose of the Hemoccult slides in a regular waste container. Remove your gloves and sanitize your hands. Chart the results. Include the date and time, the brand name of the test, and the test results for each slide. Record these as positive or negative.